The eye gel creates a non-inflatable anatomical seal of the pharyngeal, laryngeal and perilaryngeal structures, aiming to avoid compression trauma common with other adjuncts. Because it doesn't have an inflatable cuff, it is less likely to move after insertion, it's easier to insert, and there's minimal risk of tissue compression compared to other airway adjuncts, particularly those with inflatable cuffs. The cuff shape is designed to maintain blood flow and reduce neurovascular compression. The eye gel is soft to match the pharyngeal, laryngeal and perilaryngeal, or the structures surrounding the larynx. It is this airway adjunct. This is the top, the bottom, and these are the useful parts. The bite block, the epiglottic rest, the soft non-inflatable cuff, the gastric channel, and the 5mm connector. Eye gels range from size 1 to 2.5 for children and 3 to 5 for adults. Shown here is a size 3. The relevant anatomy for this video are the larynx, the esophagus, the epiglottis, and the incisors. The soft cuff of the eye gel is meant to fit onto the structures surrounding the larynx. The tip sits in the opening of the esophagus, and the epiglottic rest prevent the epiglottis from obstructing the airway opening. The epiglottic ridge rests at the base of the tongue to prevent the adjunct moving. For ambulance personnel, use the eye gel when resuscitating a patient. It's not been evaluated for this use in paediatrics, but similar devices have been tested, which is why the eye gel is said to be appropriate. The contraindications and do nots applicable to ambulance staff, according to the product's user guide, are trismus, limited mouth opening or trauma, no excessive force, don't leave it in for more than 4 hours, don't reuse it, don't use it on a conscious or semi-conscious patient, use laryngoscopy if trained to do so, or a smaller eye gel if the eye gel will not insert properly after the standard technique, jaw thrust, or a triple manoeuvre. Don't make more than 3 attempts. To find the right size of the eye gel, if the adult patient is approximately 30 to 60 kilograms, use a yellow, which is size 3. If the adult is 50 to 90 kilograms, use a green, which is size 4. And if the adult is 90 plus kilograms, use an orange, which is size 5. For pediatrics, additional weight-based information is available in the user guide or in the JR Calc. Remember that patients with wide necks or thyroid cartilage might need bigger sizes and vice versa. Next, put the patient in the sniffing the morning air position. Be sure to pre-oxygenate the patient and then prepare the eye gel. Check that it is undamaged, unopened and the correct type. Open it and place it on the cradle. Wearing gloves, place water-based lubricant on the cradle and lubricate the back, sides and front of the eye gel's cuff. Make sure that there's no excess lubricant on the cuff or on the eye gel itself. There should just be a thin layer on the eye gel only. The eye gel can be placed in the cradle until it's ready to be inserted. When it is ready, Gently press down on the patient's chin before inserting the eye gel. Some evidence is now suggesting that laryngoscopy is more effective at properly placing the adjunct, but there is little research to support this. Next, grasp the top of the eye gel around the bite block. Slide the adjunct posteriorly, with the epiglottic rest and soft cuff facing the patient's bottom lip. Slide the eye gel along the hard palate, pharynx, and into the hypopharynx with a continuous gentle push until you feel resistance. Don't insert your fingers into the patient's mouth. Make sure that the tip of the airway is now resting in the upper esophageal opening. The incisors should be resting on the bite block. Take the eye gel down after insertion, maxilla to maxilla, or you can use a device such as a Thomas tube holder, which fits around the patient's airway and has a push screw mechanism that tightens the tube clamp. Screw the device to secure the airway and fasten it as shown. In adults 3, 4 and 5, there is a horizontal line over the bite block under the size number. This is an indicator for where the teeth should be sitting, so if the teeth are lower than it, the eye gel may be too big or not fully inserted. Watch out for air leakage. If this is happening, be sure to check the depth of the eye gel. Check the size, position, insertion, lubrication, and then recheck. Auscultate the chest after eye gel insertion to ensure correct placement of the eye gel and observe chest rise and fall. There is more information available in the eye gel user guide in the other reference texts. Included here has been the information directly relevant to UK paramedics. Further videos relating to the eye gel and other airway adjuncts will be published soon.